Welcome to this Axxess LinkedIn Live conversation. We are so glad you're here with us today. We use conversations like these to bring you meaningful discussions on a wide variety of topics. We hope that you learn something from the experts that you meet along the way. We encourage you to join in the conversation in the comments and ask questions. My name is Laura Barnett. I'm on the marketing team at Axxess. Today, we're going to discuss an area of hospice care that is growing in popularity in the United States, and that is palliative care. Let me introduce you to our expert who is going to walk us through what palliative care is and why you, as a hospice professional, may want to consider adding a palliative care line of service to your business. Zaundra Ellis is our Director of Hospice Solutions at Axxess. She has served as an administrator for a number of years. Zaundra, we're so glad you're here today.
It is great to be here, Laura. I'm excited to talk about palliative care today. So much to discuss and, a new horizon for the post-acute world.
Absolutely. Let's dive right in. For those who may not know a lot about this specialized level of care, what is palliative care?
So palliative care, like hospice, really focuses on pain control and symptom management. However, there is no specific diagnosis, like a terminal diagnosis that we have in hospice. We don't see that in palliative care. And we also don't see those certification periods and those certificates of terminal illness. So a little bit different in that way. A lot of folks who maybe will use cancer for an example, maybe they're a new cancer patient, maybe they're in the hospital or maybe at the physician's office, they can start receiving palliative care at the time of their serious diagnosis. So to mitigate some of the effects of the treatment that they're going to be receiving. So it really is, very fluid inside of healthcare. And, our friends at CMS have not really defined it for us. So lots of people have different ideas about what it is, but it is very much separate from hospice. Same focus of care, not end of life, but that pain control and symptom management. So really, it's whatever you want it to be.
If we think of hospice care like looking at a puzzle built up of puzzle pieces, what does that palliative care puzzle piece look like? Or is it multiple pieces?
So it can be multiple pieces. I think the easiest way to explain it is if you had 3 puzzle pieces, right? That palliative care puzzle piece would be the connector. Right? So it takes lots of things because, it has so much in common with hospice. We see hospice agencies kind of venturing out into palliative care, starting to dip their toes in the water, as it were. But it really connects the other post-acute providers, even hospitals, right? So it's that link between the hospital, the patient on palliative care, and the hospice organization. So it's multiple pieces because billing's different, right? The regulations are very, very different. So, it's lots of pieces, but the main one to keep in mind is what we talked today is the link between community health, acute health, like hospital folks who are in the hospital, right? And then that existing hospice organization.
So as we all know, we're working from home and have been for quite some time. Folks are spending more time at home with COVID-19, and it seems like a switch has flipped in that there's an awareness and a realization that maybe home is the safer place to get care. We saw that folks didn't necessarily want to go into the hospital when they were ill with something, earlier during the COVID pandemic because they didn't want to contract something. Folks are spending time at home. What do people need to know about palliative care for themselves, for their loved ones, particularly in that home setting?
So I think it's important in that home setting, kind of without the guidance of a hospital case manager. I think it's important to really think about when is kind of the right time for your loved one to receive palliative care services. So absolutely, they can receive palliative care services in their home. Let's get that clear just from the start. That is absolutely an option for them. And because palliative care can come in as early as the patient requires or the physician determines, it's always a good time to ask about palliative care. If you have a serious illness or your loved one has a serious illness, you need to be an advocate and you need to talk to your providers, physicians, and inquire about palliative care. What does that look like for my mom or my dad or even for myself? Because it really is to improve the quality of life of folks who are diagnosed with a serious illness. I don't want to even say suffering from a serious illness, right? Because we're trying to mitigate that suffering with palliative care. But it is out there. You just have to ask. And in many ways, our folks have always, our patients and their loved ones, my family, your family, Laura, the whole team at Axxess, we're losing out if we are not advocating for ourselves when it comes to our own health care. So, I'm glad to be providing a little information about palliative care today. And hopefully someone will see this and go, hey, that might work for me. So, and, don't forget the kiddos too, because there is pediatric palliative care as well.
Mm-hmm. Coinciding with that consumer theme, how does palliative care get paid for?
That's an interesting question. So currently, palliative care is paid for out of Medicare Part B. So along with that Medicare Part B benefit, there are copays that go with that. So, our families, patients, they need to be mindful of that. For the more Medicare aged folks, those private insurance, the Medicare Advantage, the ACOs, some of them will have a palliative care benefit. And so that would require checking with your benefit plan, but it is much different than Medicare Part A, and, the hospice benefit that we talk about. So it does require consumer education. And again, advocacy for yourself or your loved one who needs palliative care.
So let's shift gears a little bit and talk business. Why should hospice providers consider creating a palliative care program within their current line of service?
So that's a really interesting question, Laura. And I think, looking back, my initial palliative care training was over, 10 years ago, right? So we have a lot of pioneers, palliative care pioneers in the industry that have paved the way and continue to innovate, right? So palliative care grows and changes and evolves according to patient needs. So that's a very strong tool for providers who are considering to joining palliative care or joining palliative care to their existing service, right? Is knowing that you're not going to be the first one to hop in, right? We also know that there are reports out there of how palliative care has really decreased hospital admissions, and ER visits. That's invaluable to the hospice. So the hospitals, I can get this right, I promise, hospital, they really, that's a big quality and financial risk for them when they have patients kind of bouncing back and forth from home to the hospital, right? So it's a good time from a marketing perspective, right? That's a really strong marketing tool for you to be able to go in and say, hey, listen, I can really help keep your patients, out of the hospital earlier than when they come on hospice, right? So let's start that now. And, the hospice that's starting palliative care, they can really, I'm going to use our term, right? They can really kind of fill their sales funnel with those referrals because it's a one-stop shop for the hospital. So, it's good for the community. it's good for the hospice. It's good for the palliative care industry. So, it's really kind of a no, there's no risk to it at all. Once you learn how to do it, it's just the right thing to do. And to continue to grow in the post-acute industry, you're going to have a palliative care program.
So with everything that happened in 2020 and with this ongoing public health emergency, we're seeing good numbers now, but we don't know that we're out of the woods by any stretch. Is now the right time to add palliative care to the services that you already provide as a hospice?
So the short answer is yes. However, it is important for hospice agencies to take a step back, right, and develop a strategic plan for how they're going to provide palliative care services, right? So it's one thing to go out and see the patient and provide the support that they need. It's another situation or completely different situation when you're talking about running the business, right? So you're talking about your reimbursement, you're talking about staffing, policies and procedures, there's lots of things that go into it. So you just want to make sure that, yes, it's a good time, but just make sure that you're methodical in developing that strategy of how you're going to help this palliative care program thrive and grow.
Something you touched on earlier, and I want to expand on that. You talked about how this kind of care isn't regulated. So how do people measure quality care if there isn't a regulation around that?
So that's an interesting question, Laura, and I think it's important to clarify that palliative care is not regulated, but the services offered inside of palliative care are. So if you have nurse practitioners or RNs or social workers going out making those visits, they have their very own licensing requirements that they have to follow as a professional. So, and then we do have a couple of states that are, wrapping their arms around palliative care and providing some guidelines. So I think it's important to, really understand. And from a quality perspective for hospice organizations, I would say leverage your CAPS, right? We're already collecting that HIS data about the quality and then the patient satisfaction. You can leverage that, right? And then you can also, as you learn more about palliative care and figure out the direction that you want your palliative care program to go in, then you can, add more quality scores to that. So, there's a myriad of ways to address quality, and everybody has a different perspective of what's important. But, it's important for the hospice that's providing palliative care or the palliative care organization to really own their quality scores and their patient satisfaction scores, right? And then as they grow, they can refine or, expand those measurements as they grow.
So I've been learning a lot about palliative, kind of dove into the deep end of the pool recently. I do know there are 3 different models for a palliative care program. What are those, and how does a hospice select the level that's appropriate for them?
So the 3 models, so you have the consultative, right? So that can be a physician who, visits you independently and manages your pain and symptom control, your symptom management. That can happen in your home, that can happen in the hospital, but that's kind of the Lone Ranger, right? And then we have kind of the co-management group, and that's where you have a group of specialists. So maybe you have your palliative care nurse practitioner or physician, maybe you have a cardiologist or an oncologist, so it's more of what we in hospice know as kind of more of an IDG, an interdisciplinary group, right? And then you have the case management. So case management is really the organization, so the palliative care organization, taking on full responsibility for that patient's care. Now, that doesn't mean that they're operating in a vacuum, but it does mean that they're coordinating care between all of the providers who might previously have been, just that consultant on the case. So it really brings in the whole picture. So, I think hospice organizations or palliative care organizations, they really need to spend time understanding the demographics of the community that they serve. They need to understand the healthcare systems that are that are active in their community, and have those conversations with healthcare leaders, with their teams. If they're part of a larger organization, obviously, the leadership, the executive leadership, to really determine what is the best route for them to go. So in my mind, I think, that case management is the way to go, because it's what we're doing in hospice already with the IDG group. So, that's just what I think. But it's really important to spend the time understanding the data that your community and other healthcare providers put out there, so that you can develop a strategy to ensure your success.
Data is so key to so many things. Getting into kind of the nitty gritty, and before we go, what licenses do providers need to obtain, and what steps follow after that? If they say, we are going to dive in, we're going to do this and care for more patients in our community, what's the to-do list look like?
So I would say the to-do list, we talked about developing that business plan, and that's really all encompassing from your patient care to your billing to, your quality scores to job descriptions. Like, it's a lot, right? So that's one of the first things that you want to do. Like I said earlier, let me digress a little bit. What I said earlier about there's not strict regulation around palliative care on the CMS side, right? But there may be some regulations from your ACO, maybe your insurance provider. So you want to make sure that you really understand the landscape at the beginning. That's super important. So you've got your business plan, you're understanding the landscape of licensing requirements. So, and we talked about those professional license requirements in palliative care that don't go away just because palliative care is not licensed. So, but what's really super important that we haven't talked about yet is that Medicare Part B billing. So if you are a hospice provider and you're going to dive right into the palliative care pool, before you even dip your toe, you need to make sure that you understand Medicare Part B billing. You understand what your revenue stream, what you can anticipate, but more importantly, the application process. So, the palliative care provider is going to need to be able to, they have to submit one application, and then each physician, nurse practitioner, those folks that are going to see the patients, they have to have their own Part B billing. So it's very complex, but I think those are the first steps, right? Your strategy, your licensing, and your revenue. Because without those things, you're really not going to have a business, right? Those are the ways, right. Those are the little big things that make organizations successful.
Now, I know folks have another opportunity if you have piqued their interest, and I'm sure that you have, and they think, I really want to get into this. Folks have another opportunity later on this week to learn more from you. Talk a little bit about the webinar that you're hosting.
Yeah, so I'm really delighted to be presenting with Hospice News, palliative care, the power of palliative care. And we're really going to dive deeper into some of the things that we've talked about today. So, we're going to talk more about what are the specific applications that you need to fill out to be a Medicare Part B provider. We're going to talk about really analyzing your community, and we're going to go dive deeper into those resources that are out there. CMS has lots of data that you can leverage, or organizations can leverage as they're developing their program. So we're going to talk about those things, and we're going to talk about, the nitty gritty of the to-do list, right? So it's going to be more of a to-do list than just a presentation of me talking, right? We really want to dive deep in and give people tools that they can use as they consider joining the palliative care marketplace.
I think I read earlier this year that 14% of people worldwide who need palliative care actually get it worldwide. Really. So we're looking at global health, which is, a huge horizon. So certainly, hopefully folks see that this is a tremendous opportunity to care for more patients and provide the better outcomes, which I think certainly is what hospice really is driven to. We know what the outcome will likely be, but if you can help it along the way and help the patients and their families, then you're doing the work you've been called to do, which is really a special opportunity to get to do that. Zaundra, thank you so much for joining us today. I really appreciate it. The link to register for that free webinar with even more details to build the palliative care program is available in our chat for this session. Thank you all so much for joining Axxess for this LinkedIn Live conversation. We're going to bring you more discussions just like this one. So be sure to set your notifications to on LinkedIn for our next broadcast. We'll let you know when those are coming up. And in the meantime, if you'd like to learn more about Axxess and our enterprise solutions, visit Axxess's website, axxess.com. Thanks for joining us. Have a great day.